Hi, this is Tyler Foster, and welcome to the Pharmacology section on autonomic drugs. The autonomic nervous system is the main route by which the central nervous system, so I'm talking about the brain and the spinal cord, are going to communicate with involuntary tissues such as smooth muscle, heart muscle, and glands. Now you can also think of the autonomic nervous system sort of like the automatic nervous system because it's not going to be under your direct control. Now, the autonomic nervous system can be divided into two major segments, the parasympathetic and the sympathetic nervous system, which conceptually can be thought to oppose each other's actions. The sympathetic nervous system is classically defined as fight and flight, while the parasympathetic nervous system can be thought of to rest and digest. Alright, so I'm going to give you a basic roadmap of the autonomic nervous system. Different receptor types are located all around the body. However, there are some trends that are going to be important to remember. So how do we name the neurons? Neurons can be named based on their location to the synapse. So we're going to have a presynaptic neuron and a postsynaptic neuron. And between the two is going to be our synapse, or the area where the two neurons meet. There are the presynaptics and the postsynaptic neurons here, and then the synapse, which is in this joint space right there, is our synapse. So our postsynaptic neuron is then going to go on to exert its effect on some target tissue, such as the heart, for example. Now, this picture that I'm about to present is going to be of the central nervous system. Don't freak out when I show it to you. There's a lot going on here. So, this scary picture is going to show the central nervous system and some target organs. Now, what do I mean by that? We've got our brain and our spinal cord constituting the central nervous system. Then we've got some target tissues such as sweat glands, adrenal gland, muscle, etc. Now, we also have it categorized into parasympathetic, sympathetic, and somatic sections. I'll be covering all of these, but first, there's one thing that all of these systems have in common. The autonomic nervous system is a disynaptic system, and the first synapse, or preganglionic synapse, is always acetylcholine acting on a nicotinic receptor. So we've got a neuron, our preganglionic neuron, which is going to synapse with another neuron here, and here is our first synapse. Now, like I just said, the first synapse is always going to be acetylcholine, abbreviated ACH, acting on a nicotinic receptor, which I'm going to label it with an N. So it's going to be acetylcholine acting on a nicotinic receptor. Now, this is going to hold true for everything. We've got our parasympathetics. We've got our sympathetic, where we're going to have a synapse here, and this is going to be acetylcholine acting on a nicotinic receptor. Surprise, surprise. Alright, so our parasympathetic and our sympathetic are always going to have the very first preganglionic neuron meet up with our postganglionic neuron, and in between in our synapse we're going to release acetylcholine onto a nicotinic receptor. Now, the adrenal medulla is going to be an oddball here. It's going to be our one exception to the disynaptic system, as the preganglionic neuron here is again going to synapse right on this receptor. However, recall that the adrenal medulla is derived from neural crest tissue. The preganglionic neuron will synapse or terminate directly on the end organ. Unlike here, we had a neuron to a neuron. Here, our preganglionic is going to go from the preganglionic to our end target tissue, just with the adrenal medulla. So it can be thought of as a ganglion itself. Now, why do I say that? It's because the adrenal gland releases catecholamines postsynaptically into the bloodstream. So therefore, it can be thought of as a ganglion itself. Now, acetylcholine is the neurotransmitter of the postganglionic neuron in the parasympathetic nervous system. So let's travel back to the parasympathetic nervous system. Here, we have acetylcholine again, and this is going to act on our smooth muscle, our glands, and nerve terminals. Now, this is usually going to be on a muscarinic receptor, so I'm going to label that with an M. Again, we're using the same neurotransmitter, However, it'll be on a muscarinic receptor. And I'll cover these in a little bit. So how does the parasympathetic nervous system differ from the sympathetic nervous system? Now, like I just said, acetylcholine is going to be the neurotransmitter released from the postganglionic neuron onto our parasympathetic system target tissue. The sympathetic nervous system, on the other hand, is going to communicate via end organs via a little different route. It's going to use norepinephrine as a neurotransmitter on alpha or beta receptors. So we've got norepinephrine acting on alpha or beta receptors here. So that's going to be one of the differences. While in the parasympathetic nervous system, our postganglionic neuron is going to use acetylcholine. Our sympathetic nervous system is going to use primarily catecholamines such as norepinephrine. Now there is an exception to this, and this is going to be sweat glands. Now sweat glands are going to be using acetylcholine as a neurotransmitter. This is one of those exceptions that you'll want to remember for the step 1. Sweat glands will use acetylcholine, typically acting on muscarinic receptors. And then also we've got renal vasculature, which is going to be another exception, and that's going to be dopamine acting on D1 receptors. Most end organs are dually innervated by both the sympathetic and parasympathetic nervous systems, so they are on both the sympathetic and the parasympathetic side. Now, before we start covering the different receptor types, I'm going to give you a little bit of a receptor flowchart to help organize the following material, because it is a little confusing. This should act as sort of a table of contents for our story over receptors. Now, we're going to start with the general category of receptors. Following me so far? Alright, let's break this down a little bit further. Off of this, we can break down receptors into being classified as either cholinergic or adrenergic. Now, cholinergic receptors use acetylcholine as the transmitter, and adrenergic is going to use catecholamines, so norepinephrine, for example. Back to the cholinergic receptors, we can further break this into nicotinic or muscarinic receptors. Remember, we just covered those in a previous slide? Now, the adrenergic receptors can be further broken down into alpha and beta receptors. So, the alpha and beta receptors can be further broken down into alpha 1, alpha 2, beta 1, beta 2, etc. But this is a very simplified chart that I want to break it down into. We have the general category of receptors. Primarily, we have cholinergic and adrenergic receptors. Now, off those cholinergics, we have nicotinic and muscarinic. Off those adrenergics, we have alpha and beta. It just depends on what tissue we're going to be talking about. However, we'll break these down a little further. These are just the subcategories, and this is just a general roadmap that I want to give you. Now we've got a quick little flash quiz to go over. So which two components of the sympathetic nervous system are innervated by cholinergic fibers, meaning they're going to use acetylcholine as the neurotransmitter? Now, I covered this a few slides ago, so hopefully you're paying attention, but this is going to be an important concept for the USMLE since it is just a little bit different than we would expect. Think you got it? Remember that the sympathetic nervous system is the fight or flight system, and it mostly uses catecholamines such as norepinephrine. However, there are two exceptions that are going to be tested on the USMLE. This is going to be the adrenal medulla and sweat glands. Now, these two are different because both of these are innervated by cholinergic fibers that use acetylcholine. The adrenal medulla is innervated only by preganglionic neurons that release acetylcholine, while sweat glands, on the other hand, are innervated by the sympathetic nervous system that use acetylcholine acting on muscarinic receptors. So remember these caveats because the test day, they may end up giving you some easy points because they're just different than normal. Now let's talk about acetylcholine receptors. There are two major types of acetylcholine receptors. Remember I said nicotinic and muscarinic. That was from our little table of contents roadmap that I gave you. Now both are going to use acetylcholine, however they're going to function a little bit differently to mediate an effect. Let's begin with nicotinic receptors. How do nicotinic receptors function? Well, nicotinic receptors are ligand-gated sodium-potassium channels that open when acetylcholine binds. So let's do an example here. We've got a phospholipid bilayer of our cell, and within this bilayer we've got this transmembrane receptor. This is our nicotinic receptor. So we've got two different sides of the cell. This is inside the cell. This is the intracellular side, and this is the extracellular side. Like I just said, the acetylcholine is going to bind to the receptor. And this occurs on the outside of the cell, causing the sodium-potassium channel to open, thus mediating an influx of sodium into the cell. There are two types of nicotinic receptors. There are the N sub N receptors, and these are going to be our nicotinic neuronal receptors. These are found on the autonomic ganglia. Then we've also got an N sub M class, and these are the nicotinic muscular receptors, which are found at the neuromuscular junction. On the other hand, muscarinic receptors are G-protein coupled receptors that act through second messengers. How do G-proteins work? A G-protein is a multi-unit protein, and they're bound to a receptor, such as a muscarinic receptor. In this picture here, we have a muscarinic receptor, that's the transmembrane protein here, and it has a bound G-protein subunit to it. When the receptor is stimulated by acetylcholine, the G-protein subunits get modified and separate from this receptor. And these go off and leave to exert downstream effects. We'll cover those effects here shortly. There are 5 different types of muscarinic receptors, M1 through M5. The M2 and M3 subclasses are going to be the most important for step 1, but we'll cover those here in a minute. This slide is a good way to compare and contrast the mechanism of these two different receptors. Despite using the same neurotransmitter, acetylcholine, the nicotinic receptor acts as a channel to exert its effect, while the muscarinic receptor uses a G-protein system.